Good morning, everyone. This is Dr. Katie Woodley, the natural pet doctor. This is Coffee Talk with the Doc, and today we're going deep into kidneys and the urinary tract system with our pets. Have you ever had a pet that's had kidney disease? Maybe a cat or an older cat, or maybe you've had a dog that developed higher kidney values on routine blood work, and you had no idea that there were any issues with your pet. And that's why we're talking about this important topic today, because kidney disease can go undetected until 75% of the functional units of the kidney are gone before they start showing symptoms. So let's talk about what you need to know as a pet parent so that we can hopefully prevent this from happening to your dogs and your cats, or we can find it sooner so we can start treating it sooner, because we can't always prevent everything, right? I know that, unfortunately. However, let's talk about what kidney disease is, what the kidneys do in the body, why they're so important, and then go into some of those steps that we can take from a more holistic perspective to help your pets live their best life. So as you're joining us live, if you're watching this live, definitely say, hey, drop those questions into the comments and we'll go through the questions that you have regarding kidney disease, urinary tract disease, and we'll go through all of that today. So what are the kidneys? Okay, we all have them. Dogs and cats have them. There's two of them usually. I have had some patients where they were born with only one. And so that's super important that we make sure that we're doing everything possible to keep that pet healthy if they only have one kidney. So the functions of the kidneys, what they do is they remove the waste products from the body. So break down products from bacteria, the food, toxins that these pets are coming into contact with. They also regulate electrolytes. They also help with blood pressure. They make hormones. They're essential to calcium and vitamin D metabolism. And also, they make an important thing called erythropoietin that helps with red blood cell production. A lot of people don't realize that the kidneys do so much in the body. They're so important. And so when they're removing and filtering out this toxic waste, if they're not working, that sits in the pet's body. That makes them feel awful. And then we have a whole host of other issues because of that. So what those kidneys do is they're filtering these things out, and those products are being removed out of the body through the urine. And so we need to make sure that we're supporting that filtering system, supporting the natural detox system of the body, so those toxins aren't staying inside your pet. So they're also, what they're doing is not only are they removing toxins and things that we need to get out of the body, but they're reabsorbing things like protein. And they're helping the body maintain the things that they need to have. So a lot of times what we'll see is we talk about kidney disease. We have two different types. We have chronic kidney disease, and you'll hear us talk about CRF or CKD, so chronic kidney disease, CKD, or chronic renal failure, CRF, chronic renal disease, CRD. So we use a lot of different acronyms, which is important to know, like they're the same thing. And with chronic kidney disease, it happens gradually. So this is over time. And our kitty cats are definitely more prone to this than dogs. However, I do see a lot of kidney disease in dogs, unfortunately. And because it happens so gradually, sometimes we don't see those symptoms until it's progressed and we are into that later stage of disease that we can't reverse. There's not a lot that we can do. So why does this happen? Why do pets develop kidney disease? They can be born with it. So we call that congenital. Their kidneys might be malformed, so they're not able to filter out those toxins and work as well as they should if it wasn't malformed from birth. So that definitely can happen. It's not the most common. Also, chronic bacterial infections. So if pets are prone to chronic urinary tract infections, that bacteria can actually ascend up into the kidneys from the bladder. So it passes up through the ureters and it can set up house there. Or if there's something else going on with bacterial infections, they're coming into contact with other diseases like leptospirosis. That's usually not a chronic issue. However, an acute issue, so an acute bacterial disease, can turn into chronic also. So we need to make sure that we're finding these infections if our pets have them, and we're treating them appropriately to clear that out of the body. Also, if your pet has increased blood pressure. So when I say pet, I'm talking about dogs and cats right now. So this is for both, which is really important because it can happen to both. So increased blood pressure. We want to be measuring blood pressure at our annual wellness exams for both dogs and cats. It can be a little hard to interpret because, especially with our kitties, they can be really stressed when they go to the vet. And so we don't know, is this truly an elevated value or is this normal? And so there's ways around that. So if that's happening with your pet and you want to know for sure, sometimes what they'll do is do house call visits, or they'll take the blood pressure in the car. Like traveling with the cat is still stressful, but there's ways that we can figure out, okay, is this truly an elevated value or not? Also, urinary blockage. So this is typically secondary to something else. So a bladder stone, kitties can get urethral obstruction. So the urethra is what comes from the bladder to the outside of the body to pass urine. So if there's something blocking the outflow of the urine, that pressure builds up. And this can happen with bladder cancer, unfortunately, too. And that pressure builds up because that urine can't leave. And that pressure goes to the kidneys. And that typically causes more of an acute problem. So we see a lot of times male cats will come into the emergency clinic because they have a urethral obstruction. They can't pee. They're really sick. And they can go into acute kidney failure because of that, because that extra pressure is going to break down the kidney tissue, and it's going to affect that potentially long term. So cancers can affect the kidneys. So lymphoma is a really common one that can go to the kidneys, especially with cats. And then diabetes. And that's where it's really important to be monitoring blood pressure and checking for infections, because diabetes, that's where the blood sugar regulation is off. So the pancreas is not able to release the appropriate hormones to process, and they're excreting sugar through their urine, and it sets them up for bacterial infections. So that could be a chronic bacterial infection. Their blood pressure could also be off. There's a lot of things. They're more risk of inflammation in their body. So we want to be watching for those conditions and monitoring the kidneys very closely if your pet has any of those. The last category of what can cause kidney disease is an immune mediated. So that's where something in the body goes, this is not normal, and it starts attacking itself. And so there's a lot of different immune mediated diseases that can lead to kidney disease over the long term. There are some breeds that are predisposed to kidney disease. So this would include breeds like in dogs, Samoyeds, Bull Terriers, English Cocker Spaniels, German Shepherds, Cairn Terriers. So those are a couple of the breeds that may be at a higher risk because of a genetic component. And then the cats. Cats are definitely more prone to chronic kidney disease. I saw a study that said that over 20% of senior cats will develop chronic kidney disease at some point once they're senior. So after 7-8 years of age. So we just had a kitty, Taz, that had kidney disease. He came to us, we adopted him, and he came to us with kidney disease. He had heart issues also. He had blood pressure issues. There were all sorts of issues that he had. And unfortunately, we are able to do a little for him, but a lot of cats will have this underlying issue. We're going to talk about what to watch for, so don't worry. And for cats also, some of the breeds that are predisposed to chronic kidney disease or kidney issues in general, so this could be a congenital issue where they're born with these problems, those would be your Abyssinians and your Persian cats. So if you have these breeds, you definitely need to watch them closely. I recommend, especially once they're seniors, twice annual wellness exams, doing blood work at least annually, so every year. That's whether or not they're a senior, because we're going to be able to track those trends and see if those kidney values are going up, even if they're still in the normal range. So what do we see? Like I mentioned, chronic kidney disease tends to take a long time. It can be gradual. So we're not seeing symptoms. And that's what makes it really hard and really frustrating as a pet parent to see it. I have a lot of people that are like, had no idea. And then all of a sudden, bam, their pet's in renal failure. And it's like, I didn't even notice. And that happens a lot. And it's because it's a gradual disease process over time. Things that you want to be watching for: gradual weight loss. So this is really important, where if you're noticing your cat is suddenly like feeling a little bit more bony along its spine, they're having some muscle wasting, those are things that we can watch for especially in our cats, because this is the area where they first start to lose weight. This could be gradual weight loss. So your dogs, if all of a sudden, they were a little chunky before and now they're looking really good and you haven't changed anything, something is going on inside, and you need to take them in and you need to have the diagnostics we're going to talk about done. So definitely gradual weight loss. You may notice they're a little bit more lethargic, so they're more tired, they have less energy, they may not want to go for walks more. Now, keeping in mind, when I'm going through these clinical signs, these symptoms, they're very general, and they can be for almost any disease that we see in our pets. So if you're seeing any of these, like, take them in, get them checked out. The sooner we find the issue, the sooner we find the problem, the sooner we can hopefully fix it. So whether or not, it doesn't necessarily mean that they have kidney issues, but if you're seeing any of these symptoms that I'm talking about, you need to take them in right away to the vet, get them in. They're doing okay, like it doesn't need to be an emergency, but you need to get them booked in. Vomiting, diarrhea, especially vomiting, and I see this with cats. So cats tend to be a little bit more of a chronic vomiter anyways. That is not normal. Cats vomiting is not normal. And if you're noticing that your cat is starting to vomit more, or your dog is starting to vomit, that can be because, remember, those kidneys are filtering out the toxins. And if they're not working appropriately, those toxins are staying in the body. Your pet is becoming nauseous because of them. And that's what makes them vomit. They don't feel good. And also that nausea that they feel from the toxins building up in their body makes them want to eat less. So a lot of times you're going to notice your pet is not finishing their food. They're leaving some behind. They may be getting pickier. So that's something to watch for also. Are you noticing that maybe they're drinking more? So what happens is that urine's not as concentrated and they're drinking more, but they're peeing a lot more too. And they're becoming dehydrated because they're not able to retain the water in their body. So if you're noticing decreased appetite, some weight loss, they're drinking more, they're peeing more. So cats, super easy to see, because especially if they're indoor and they have a litter tray, you're noticing big clumps, right? This with Taz, oh my goodness, like the amount of like urine clumps. And we got a water filter for him. And I mean, he loved that thing and encouraged drinking, but then he'd go and pee it all out. So if you're noticing changes in the size of the clumps in the litter tray, you need to take them in. So that can definitely be a sign. So those would be your main ones you're watching for. And if you're starting to notice trends over time before your pet's due for their wellness exam, bring them in, take them into the vet, get them checked out. So how do we diagnose this? How do we diagnose kidney disease in our pets? So this is the same for dogs and cats. So we need to run blood work. So we talk about CBCs. So that is a chemistry panel that is going to look at red blood cell count. So we're going to see if they're anemic. Like I mentioned at the beginning, the kidneys are helping with red blood cell production. So if they're not working as well, the red blood cell production can go down. They can become anemic. This is also going to contribute to them feeling more lethargic. Red blood cells carry oxygen. And so that keeps their energy levels up. They feel good. So if those are going down, they're becoming anemic. A lot of times we'll see that on the blood work. We also run a chemistry panel where we're looking at electrolytes. We're also looking at BUN, so the blood urea nitrogen levels. So those are the toxins that the body is supposed to get rid of. And then creatinine levels. So BUN and creatinine are two of the most common ones we look at when we're diagnosing a kidney issue. And those are going to be high. And then we're looking at those electrolytes. So potassium is a big one that's urinated out. It's not retained by that kidney filtering it. And so a lot of times we end up supplementing that. And that's important to know if your pet is low. So that way we can ensure that if we're doing fluids, if we're doing foods, we're supplementing that to make sure your pet is having the right levels of potassium, this can lead to muscle issues, more lethargy. It can also create heart issues. Major issues can happen when these electrolytes are off. And so we're going to look at that with the blood chemistry, the blood work that we're doing. The other thing that we want to be doing is checking a urinalysis. A lot of times if we see BUN and creatinine elevated, if we have not looked at a urine sample and those values are only slightly elevated, we don't know if it's dehydration. Is your pet dehydrated? Those values are going to go up slightly, it shouldn't be super high, but they're going to go up if your pet is dehydrated. And so when we look at the urine, we're looking at USG, urine specific gravity, and that's going to be the concentration of the urine. And if that's dilute, BUN, creatinine are elevated, we have most likely a kidney issue. And so that's where also there's a newer test. It's been around for a while now, but it's called an SDMA. And I love this test because it's more specific than BUN and creatinine. So with BUN and creatinine, typically it takes about 2/3 of the nephrons. So nephrons are the functional unit of the kidney. Those are the things that are filtering the toxins out. They're taking back in the things that the body needs. Though when those nephrons die, they die back, or they go to sleep. They aren't working well. They're just not functioning appropriately. We need 2/3 of those to be gone before the urine becomes dilute. The other thing is that once 75% of those functioning nephrons are dead, the BUN and creatinine go up. So the problem there is that, okay, now we've diagnosed this, but we've lost 75% of the functioning units of the kidney. That's why it's so hard to reverse kidney disease when we diagnose it. Don't worry, I'm going to talk about diet, and I'm going to talk about some of the holistic things that we do, because supposedly we can't wake those little nephrons back up because they died. However, there are cases where we can reverse kidney disease through using certain types of herbs, supplements, and diet, where we can help these pets and slow it down and reawaken some of these little nephrons, which I love. I love seeing that. I love seeing these values go down when we start integrating holistic medicine in. So the other thing with the diagnostics, so CBC, biochemistry, you also want to be doing a urinalysis. We want to see if protein is being lost in the urine. And then we also want to do, so the SDMA test, so that's going to be more specific. If those values are high, we're catching it before the nephrons are gone. So we're going to see those values go up before we have to wait for the BUN and creatinine to be elevated. So those tests are very important. Now, the other test that a lot of times we'll end up doing is an ultrasound. So we'll do an abdominal ultrasound where we're looking at what the kidney actually looks like. So typically on X-ray and then an ultrasound. So an ultrasound is great for looking at the tissue, the structure of the kidney. And X-ray is going to show us kind of the size. So is it shrunken? Is it small like it usually is with chronic kidney disease? Or is it big? With lymphoma, typically those kidneys, they're huge. And so those are going to show us, okay, what does it look like? How does the kidney look? And that'll give us an idea also of where that kidney function is, how progressed it is it mild, is it severe? And then we grade it. So we stage kidney disease. So there's different factors that go into that. We're going to go deeper. Like, this is just touching the basics about kidney disease right now, but we're going to go a lot deeper in this month's webinar for kidney disease. So make sure if you have a cat, we're going to go really deep for cats because so many of them develop chronic kidney disease, that make sure you register for that webinar so you can get more specifics. And you can also go deeper with me in that live Q&A at the end. So make sure you register for that. It'll be in the link in the bio. If you're on Instagram, Facebook, you can register. You can also go to our website at The Natural Pet Doctor to do that also. So treating, all right, we're finally there. I know you guys are like, come on, Dr. Katie, get to the good stuff, right? How do we help our pets? And so treating, this can be really, really hard because we typically are diagnosing it later on. And so we're finding it, we have, 75% of these nephrons that are potentially dead. And we're like, oh my gosh, what do we do? Like, your pet's probably sick now too. So they're probably lethargic. They might be vomiting. They're not eating very well. They're dehydrated. Not good, right? Maybe they have high blood pressure. So these are all things that we need to know, because if your pet has high blood pressure, we need to get that regulated. We need to bring that down. We need to assess whether the electrolytes are okay so we can supplement that. And one of the number one things that we need to do is fluid replacement. So sub-Q fluids are commonly used for rehydrating them. Remember, the kidneys are not able to filter, do the appropriate things that they normally do, reabsorb, proteins, the water back into the body. And so they're just urinating it away. So we want to get them on sub-Q fluids. And this is something that we teach clients to do all the time. Sometimes it's scary at first because like, I have to put that big needle in my cat. They do really well. So typically we put it into the subcutaneous space, kind of like the lower scruff of the neck where there's a lot of skin, and they do okay. And they feel better. And that's the number one thing. We need to be replacing that. A lot of times I'll add, B vitamins, because those are going to help them feel better. It's replacing the B vitamins that they're losing through the urine. We can also look at potassium supplementations too, because remember, that's really important for muscle function, heart function, helping with some of the lethargy, the tiredness that they feel. So definitely doing sub-Q fluids or looking at that. Some pets do need to be hospitalized on IV fluids, and that's okay. If they're at that point and your vet is recommending that, I definitely recommend it. Getting them on fluids is critical to them if they're at that place and they're that dehydrated and their kidney values are super elevated. So hospitalization is sometimes a recommendation, and that gets them hopefully back to a better place where then we can use some of these other things I'm going to mention to keep them in a stable place and potentially we reawaken some of those nephrons. Diet is the foundation for health. And this is where I go on my rant and get all excited because I love nutrition and it's so important. What do we feed most cats? Like I have goosebumps because I'm like, we can do so much with food. And the thing with diet, especially cats, we feed them kibble. We feed them dry food. What does that do? It dehydrates your pet. So when we're giving our cats kibble, we are actually making it worse. We're making it more likely that they're going to develop kidney disease later on because it keeps the body in dehydrated state. Cats suck at drinking water. They're not like dogs. That's just a fact. And so if we can get more moisture into their body from the very beginning, whenever that is, whether you adopt a senior cat like we did and get them transitioned onto a wet food, or you have a kitten, start them with wet food. Just can the dry food, get rid of it. And with dogs, so we can use canned food. A lot of dogs are on dry kibble, and there is a point where, yes, budget comes into play. What's easiest? Those types of things do matter. And there are decent dry kibble foods. So that's okay if you have to do that. But what types of organic, real human foods can you be adding? The number one thing you're going to hear if your pet has kidney disease and you take them into the vet, they're going to say, get them on a low protein diet. And I don't agree. There's studies that show that it actually can make it worse, especially in the earlier stages of kidney disease, typically when we're diagnosing this. So we need to get these pets onto an appropriate, biologically appropriate. So remember, like feeding them real food that they can absorb, which is bioavailable. The body absorbs those nutrients as soon as possible. That's really, really important for these pets. And so freeze-dried raw food. Yes, freeze-dried raw food, definitely. So that is that is a good option. Someone just asked about that. And so there's different levels. Like you do not have to do a home-cooked diet. Like especially for cats, canned food is going to be better than feeding dry food. There's a spectrum. And some pets do better on raw diets. Now we want to be careful with the amount of protein. Even if it is really good for them, we need to be careful with how much protein does go in so we can use lower amounts of high quality bioavailable proteins. So that's key, is if we're feeding, a dry food and they're not absorbing it, we're putting more pressure on those kidneys, and we're also dehydrating them in the process. So that's really important to think about. We also phosphorus. Phosphorus is so important. This is so much more important than like feeding a low protein, as long as the protein is appropriate and it's a high grade, good quality, phosphorus needs to be lower in that diet. Because when we feed foods that are higher in phosphorus, so this is where a lot of people will look at like the ash content, that's the mineral content in a lot of these processed foods. If phosphorus is high, we are going to escalate the kidney disease and move it a lot faster. So we need to be looking at that. We also need to mention the potassium supplementation. So there's a product called Azadil, and it's a probiotic that also has potassium in it that we use a lot for cats. So that's a great supplement to ask your vet about if your cat's not on it, and making sure they're drinking water. Get a water filter, encourage drinking. If you are feeding kibble and you have to feed kibble, put water in it. Add water to the diet. Get your pet drinking more. That's really important. Now, supplements. So there are certain supplements, and this is where I love this. So supplements, herbs, what plants can we use that are going to help revive those nephrons? So a really common herb that I use a lot, and this depends on the individual pet. Remember, when I talk about herbal medicine, supplements, even diet, this is individual based. So this is something where you need to work with your vet, find a holistic vet or an integrative vet if you're like, I don't want to feed that prescription dry food. Like, that's not okay. So find someone that you can partner with that is going to look at your pet and go, okay, where are these imbalances? What do we need to support? How do we fix this? And Romania is one of the herbs that I use a lot, especially with my chronic kidney patients for cats. And Romania, what it does is it's this herb and it increases blood flow to the kidneys. And it can actually help revive these kidneys, these functional units, the nephrons. And what we see is the values go down. They're not supposed to happen. And you can reverse the stages of kidney disease. We've done it numerous times with using the right herbs and the right supplements and getting that pet on the right food. And so VetriScience, I love VetriScience. They're a great company, been around a long time. They have a product called Renal Essentials. So this isn't for like, if you're worried about your pet developing kidney disease and they're fine, I don't recommend just putting them on these things. Ask your vet about it, get the blood test done, get them checked out routinely. And if they start developing these issues, make sure you're working with your vet to ask them if this is worth doing. The other cool thing with Romania that I like is that there's actual studies that showcase how it acts to help reduce blood pressure. So we can use these herbs. They actually work better than some of the blood pressure medications we use in pets. So we can use these to work alongside those conventional drugs, potentially get your pets off the drugs if we can, not always, but we can use them so we don't have to use as much of the drug. That's why I love integrating holistic herbal medicine into our conventional treatment plans, because we can get so much better results. So herbal medicine, hands down. So let me sum up briefly. I went a little bit longer. We're going to go a little longer today, so just stay tuned. But let me sum up kidney disease. So we talked about the functions of the kidney. So filtering toxins, reabsorbing proteins. It's very important for hormone production to help with the adrenal glands. It plays a part in calcium metabolism. Vitamin D, so very, very important to the body. It can happen with chronic kidney disease, chronic renal failure, chronic renal disease, all the same thing. Happens gradually, can happen from congenital issues to chronic bacterial infections to high blood pressure to cancer. So there's a lot of different causes. There are breeds that are predisposed to this, so rewind and make sure you guys watch the replay once we post it. Clinical signs to watch for: decreased appetite, vomiting, lots of drinking, lots of peeing, more lethargic. Getting the blood work done, CBC, biochemistry, SDMAs, doing the urinalysis every single year for your pet, getting them in, getting it done so we can track trends to see if something's developing, and then treating. So preventative, getting them on the right diet now. There's plenty of blog posts I have, how to analyze your pet's food. You could go to our pet membership and see our webinars that we've done in the past that talk about diet and how to optimize your diet. So there's a lot happening here that you can do yourself as a pet parent to help your pet. And if you want more, join our free webinar. So register for that. It's free. And we're going to be talking, like, we're going to go deep and you can ask me questions. But keep in mind, we do this every Saturday. We talk about different health conditions with your dogs and cats, but what we do is we talk about the integrative care and the things that you can do, because I know you're here because you want the best thing for your pet. And I love that. And that's why I love doing what I do, partnering with amazing pet parents like you guys. So check out thenaturalpetdoctor.com for more information. We have a lot of blog posts. We're adding them every week, multiple ones. We have a YouTube channel, The Natural Pet Doctor. Make sure you subscribe to that. Register for our webinars. And if you want more, and you want more of this with a like-minded pet parent community, check out our Natural Pet Tribe membership. Every month we go deep. We go deep into all of their questions. So I take all the questions you ask me and we turn it into content so that it can benefit everyone. And if you need more personalized care, we do consultations, we do telehealth, we do in-person consultations if you're in the Northern Colorado region. So reach out. I'd love to help you guys. Check us out, thenaturalpetdoctor.com. Check out our membership. I'd love to see you there. We do the live Q&As, and one of our memberships also has a 60-minute Q&A with me once a month. So that's pretty dang exciting. You can ask me whatever you want and we go deep. So definitely check it out. I'd love to see you guys there. I'm not seeing any other questions. So thanks for joining in. I appreciate you coming every Saturday morning, 10 a.m. Mountain Standard Time. You can always use the hashtag #AskDrKatie with any of your questions. We'll make sure we cover those in our weekly talks, Coffee Talk with the Doc. So thanks again. I'm Dr. Katie Woodley, the Natural Pet Doctor. Have an amazing weekend. And thank you, Sue, for that. And I appreciate everything that you do for your pets. All right, take care.